Everybody, and welcome to the first panel of the day. My name is Luciano Calestini. I'm the Deputy Representative of UNICEF here in Lebanon. I've been in Lebanon. Tomorrow it will be exactly 4 years, and an incredible and life-changing 4 years. It has been for so many reasons. I think everybody has their stories of the last 4 years. The subject of this panel is tackling vulnerability. And I think that word has as many definitions as the people you would ask what it would mean. It's one of those issues that you can have 3-day workshops about unpacking the definition and you still don't arrive at a conclusion at the end. But to put it simply, maybe I can offer sort of at the most macro level, at least from UNICEF's perspective, we would understand vulnerability as the susceptibility of a person or a family or a community or a system to the effects of a hostile environment. But then when we look at the one layer down in terms of informing a response to a natural disaster or a complex humanitarian crisis, then we look at the ability of, again, an individual, a family, a community, or a system to resist shock, whether that shock be economic or physical or social or environmental. Mimi and Philippe both spoke of some of the work that has been done by many, many actors over the last, let's say, half a decade now in Lebanon to understand what vulnerabilities are of the various communities that have been affected by the crisis here over this last 5-6 years. And I would just touch on two as a way of introduction that are probably for the UN family at least the most significant. One is called the VASIR, some of you may have heard of, which is the Vulnerability Assessment of Syrian Refugees, an annual mass data collection event to help us answer the almost impossible question of who receives and who does not, given that we're in a context of scarce resources and needs forever exceeding those resources. That means that we're also in a context of making heart-wrenching decisions on a daily basis, and that exercise is what helps us understand at a very, very micro-family level who is the most vulnerable and therefore eligible to receive the assistance that is available. From UNICEF's perspective, of course, vulnerability is broader than the Syrian refugee cohort alone. As the agency with the mandate for children, regardless of nationality or legal status, we have a purview over anyone who's under 18 on the territory of Lebanon. And so for us, we have a complementary analysis that we affectionately refer to as the 251, and that is an exercise conducted with different ministries, including MOSA, initially the Prime Minister's Office as well, all UN agencies, and a number of NGOs, where we looked at geographical vulnerability. So where in Lebanon, of the 1,700 or 1,800 different localities, where in Lebanon do we find the most geographical stress? And if you do a little bit of digging, you will find that in 15 or 16% of the territory of Lebanon, you find well over 80% of the Syrian refugee caseload, 2/3 of the poor Lebanese caseload, and over 90% of the Palestinian refugee caseload. So there is a possibility, if we dig, to understand and make far better informed decisions. And that is, in fact, I guess, the crux of this panel today, because tackling vulnerability is not just about an academic exercise to understand what it is, but also it must inform what we do about it. So we have today 4 eminent panelists on my left who are each speaking about subjects that are very dear to UNICEF's heart, I would say. So thank you, Nasser, for inviting me to moderate this very UNICEF-y child rights panel, I would say, where we'll be talking about analysis and response to nutrition issues, to an emerging and deeply troubling phenomenon of child marriage in Lebanon, which is one of the negative coping mechanisms that Philippe spoke about earlier this morning. We'll be talking about the huge challenges of access to public health, and particularly maternal and child health, and something that is often under the radar, but an increasingly fundamental pillar of ensuring that children are able to access and utilize services, and that is the issue of psychosocial support and the psychological impact of crisis on children. So if I may ask the first speaker, Dr. Lamis Juma, I have extremely intimidating bios for each of these panelists, which I don't want to read because it makes me feel very inadequate. But Dr. Juma, in short, is an assistant professor at the Department of Nutrition and Social Sciences here at AUB, and a Fulbright scholar with a very long and impressive list of achievements and academic endeavors under her name. With your permission, Dr. Juma, I will not read the entire list, and I will hand over to you. Just to mention, the structure will be, we have 12 to 15 minutes per panel, per speaker. If you can please keep your questions, write them down, and we will have a good solid 20 to 25 minutes at the end to come back with whatever you would like to clarify or remark. Okay, thank you.
Thank you. I'm just going to need somebody's help in order to project this, because I can see it on my screen, but I can't see it on this screen. Sorry for the delay. I can probably start talking. First, I want to thank the organizers of the AUB4Refugees initiative for actually inviting me, and I'm very happy to be part of this initiative. Thank you, Dr. Muhtasib and Dr. Yassin. Today, I'm going to be sharing findings from a research project that has been conducted in partnership with several colleagues at AUB, between Faculty of Agriculture and Food Sciences and Faculty of Health Sciences and FAFS. Can we project without the notes? Sorry, not to bother you, but great with technology. It helps. Okay, so the title of my talk is about the comparison of the food and nutrition security status of Syrian refugees and their Lebanese host communities in Lebanon, the case of Akkar, a district in the north of Lebanon. What is food security? Food security, by definition, is when people at all times have safe, sufficient, nutritious access, for social and economic access and physical access to, thank you. So food security exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their dietary needs while also respecting their preferences in order to lead an active and healthy lifestyle. So this is quite a common definition I know most of you are familiar with. And it's not to the surprise of this audience to talk about the conflict and its impact on food security. We know that increased risk of conflict may increase also population pressure. It increases migration, which in by itself would increase competition over resources, particularly in systems that are pre-existently weak. As I'm borrowing from some of the words that of the speakers earlier this morning, Lebanon pre-crisis had its own issues, and we continue to have some challenges regarding that in terms of the rate of poverty, in terms of bad governance, and whatnot. All of which affect definitely the level of food insecurity at a national level. As we enter the 7th year into the Syrian war, this huge global issue, which is the humanitarian Syrian crisis, has had its effect not only on the refugees, as we were saying since morning, but also on the neighboring nations. A lot of them fled their country to seek asylum in neighboring countries like Turkey, Lebanon, all the way reaching up to Libya. In Lebanon alone, we have 1,017,000 registered Syrian refugees. This figure may change every couple of months. This is the most recent UNHCR data as of September 2016. It's a bit actually lower than the figures of January 2016 of last year. When we look at where are most of the refugees in Lebanon, we notice that they're mostly between the Bekaa in the east of the country and the north of Lebanon. According to the, sorry for this is a bit hidden, according to the WFP Wazir Vulnerability Assessment for Syrian Refugees that you were just mentioning a few minutes ago, this is actually a very important survey that's being conducted by WFP with many of their international NGOs and support of UNHCR and UNICEF and other organizations. They were looking at food security among other factors, education and health. And I know some of my colleagues will be touching upon that, so I'm going to move forward and focus mostly on the food and nutrition part. There's a high burden of diseases, but there's also very signs of low dietary diversity reported at the household level. Also, we have 93% of the Syrian refugees suffering from food insecurity, some form of food insecurity, in 2016 alone. This figure was actually an increased figure from the 2015 data. If we were to look at Akkad, which is all the way up to the north of the nation, it's actually known to be the most rural and among the most poor districts even before the pre-crisis, the Syrian crisis. Now, what are the challenges that are faced by the refugees in Lebanon, the Syrian refugees in particular? Humanitarian aid remains quite a challenge because it's, despite the galvanized efforts and all the money that's being pooled, not to undermine that, but there are still a lot of challenges in terms of this aid reaching all the vulnerable sectors and also in terms of whether it's sufficient or not. Most of the refugees reside in impoverished settings, in informal tented settlements, which pose their own risk in terms of the health and the burden, as well as impact on the food and dietary diversity of those households. There's also a lot of talk about the competition over livelihood opportunities between the host and the refugee population in terms of job opportunities, inadequate housing, limited educational and health services, and which brought the issue of exploring further the social tension that has been also the interest of many partners across the nation. Despite its importance, I'm not going to be touching base a lot on the social dimension part. However, I was interested from my nutrition background and bias. I was really interested in looking what's kind of data out there in Lebanon and seeing if we could add helpful information. And we do know that there's a lot of work done on the refugees particularly, and the Wazir is an example of that, as I just said. However, there wasn't and there isn't much talk about the Lebanese host community and their food security status. So in addition to that, another challenging issue is there any data pre-crisis versus post-crisis to see if it's true that this competition that we talk about, is it really affecting the Lebanese households as much as we're talking about, from nutrition and food security angle. So these are some of the issues that we're facing. We also lack individual level data, particularly when we talk about vulnerable subgroups such as children and women, in particular mothers. Literature shows that the mothers tend to compromise their own dietary intake in order to provide for their children. I'm not surprised now that I'm a mother actually of a 3.5 months, two twin babies. I'm actually not surprised with that. I would put them ahead of me definitely. The purpose of this study, then, is to compare the food security status of Syrian refugee households and their Lebanese host community in the region of Akkad, and I had secondary outcomes interested in particularly the nutritional status and dietary intake of children and mothers. In the interest of time, because of our very limited time today, I am going to be presenting only the children data and the household level. We conducted a cross-section study between October 2015 and March 2016 in the district of Akkad. The sample size that was calculated was 324, and that was based on attempts of looking at the effect size of a difference in prevalence rates between the refugee and the Lebanese households, depending on data that we have found across the nation. Some figures from about food insecurity, about Lebanese in the south of Lebanon, some in the Bekaa, and of course with the refugees the data is much more developed and much more available. We wanted to look at 3 different, if you want, groups. The first group was the refugees themselves, and we took an equal distribution of households, 108 from the refugee group, another group from the Lebanese households, because as I said, I was interested in looking at the comparison. A group of Lebanese households from the communities that have actually hosted a high number of refugees. So I'm going to call them from now on basically the high SR population, or the Lebanese from the high SR villages. And the Lebanese households from other villages, I've divided them between 8 villages between 4 for those that have high Syrian refugee load, and another group that has low Syrian refugee population to none. And these, I'm going to show you the map in a bit about Akkad, there are not plenty, because the majority of the villages in Akkad have actually been hosting refugees, given the proximity to the borders. I will call this the comparison group because we were looking at seeing if there's any pre-crisis data in Akkad. And unfortunately, there weren't on food security. So we would consider this as if it's a comparison group to mimicking almost the pre-crisis situation, to the best of our ability, of course. We were interested, as I said, in looking at this district. It has 293 villages, 217 of which are currently hosting Syrian refugees. As I said, we divided them in between 8 villages, 4 from the very high and 4 low to no Syrian refugees. We tried to select villages in comparison that are very similar in community characteristics and in background information. We used a lot of cross-cutting, if you want, information from different sources, some of which are Lebanese resources and some of which are the UNHCR, and also contacting directly the municipalities to get, for example, the number of hospitals, the number of schools, what facilities, what services are out there, just to make sure that we are comparing relatively similar villages to the, also again, to the best of our ability. As we can see here, we have the villages with the high Syrian refugee load population that we looked at. Let me kind of go down a bit faster. So the stars, the blue stars tells us where are the villages with the high refugee burden. The color can also tell us because the darker mahogany color is basically where the refugee concentration is high. The green villages are the ones that have the low to non-refugees. In terms of inclusion criteria, we were interested, as I said, in households that have mothers and children between 4 to 10 years old. And we're interested in refugees who have been in Lebanon for more than 6 months because we know that their characteristics of those who have just arrived are completely different. The kind of food aid that they receive is also different than those who have been for a longer period. In terms of the recruitment, we went household visits, consecutive household sampling approach. We had trained research assistants who got the consent of the mother and the assent of the child. And we provided an incentive, which was basically nutrition counseling and sometimes even booklets, depending on the literacy level of the household that received us. The questionnaires that we used, Arabic translated validated tools for the food security and for the coping strategy, also that one is used by the WFP. In terms of the dietary intake, we used the 24-hour recalls and the household food consumption score. In terms of anthropometric measurements, as you can tell here, the MOAC is the mid-upper arm circumference, but I'm not presenting the data much on it because there were very low numbers of that. Quickly, the results, because I think this is the most exciting part of the presentation. Did we find differences between the refugee and the Lebanese households? It was no surprise to us that we would see SES differences, socioeconomic differences. We noticed that the mother's educational level was higher in terms of among the Lebanese. The employment status was higher, even though in general it was not high among both, given the rural aspect of the region. In terms of the employment status of the men, the Lebanese men had significantly higher employment. And in terms of income, no surprise that the refugees had lower income and higher crowding status, which is usually an indicator of low socioeconomic status. I'm not presenting here, I noticed the food assistance, although we did look at it in different forms, and there was a significant difference. Refugees were receiving much more than the Lebanese. So at the first tier, we were looking, as I said, among Syrian versus Lebanese households. We can tell here from this graph, that there is a significant difference in terms of the severe food insecurity levels between the Syrian refugees and the Lebanese households. However, what was remarkable, this is 80%, which is kind of almost similar to what I was talking about, Vazir report at the national level. They were presenting 93% of the country having food insecurity of some form. Well, if you add these two together, that's some form of food insecurity. The Akkad district is very similar to the nation data. In terms of the Lebanese, what caught our attention is the moderate level of food insecurity that was also high, even though you have half of the population that we sampled were food secure, but moderate food insecurity was interesting there. So we were interested in looking even further into the Lebanese among themselves. So those that were from the comparison group, and the other group which had the hosting, if you want, population that are living in neighboring communities with the refugees. Did we find differences? Yes. In addition to what we saw earlier between the refugees and the Lebanese, we're noticing here a higher level of overall food insecurity of some form among those that are receiving the Syrian refugees in higher proportions. When we looked at hunger, which is some kind of a division from the household food insecurity access scale, we noticed that also, unfortunately, the levels of moderate to severe hunger among the refugees quite high, significant between both Lebanese and refugees, but not to undermine that the level of moderate to severe hunger is also high among the Lebanese households themselves. I consider this to be something significant that is worth exploring, even though they're not different among them. But we're talking moderate to severe hunger. This is quite advanced, not just early food insecurity. What are the coping mechanisms that these households are basically adopting in order to cope? They are depending on different, from the least, if you want, severe to more, and there's actually more severe options, but we haven't asked all the questions and presented all of them even here. Probably you'll talk more about the marriage. I know Dr. Abdurrahim Sousan, you'll talk about that, and that was one of the questions that we had. Lebanese thought they frowned upon the question, but the Syrian refugees thought this was a very normal question. So they rely on less preferred, less expensive food, of course. There's a reliance on help from a friend or relative, limited portion size. You go down, you notice that some of them send families to eat elsewhere because they want to reduce the burden. We looked at the differences in terms of the household food consumption score. Is there a difference between the Syrian and the Lebanese household? Yes, there is a poorer to borderline poor food consumption among the refugees compared to the Lebanese. I explored also the Lebanese among themselves. They were actually 94 and another is 98%, but no difference. So they were acceptable food consumption for Lebanese among themselves. But I will show something that's interesting about among the Lebanese in a minute. It's going to be faster. So here, sorry, this is the data that was just saying there's no significance. If we were to compare the refugees to Lebanese in terms of their consumption at a household level, lower intake of nutrient-dense foods, whether in terms of vegetables, fruits, proteins, eggs, and dairy products among the Syrian refugees compared to the Lebanese. If you were to compare the Lebanese among themselves, we noticed that the vegetable and dairy product consumption is lower among those groups that are hosting higher refugees. So if I were to think of it as a pre versus post-crisis, then I am seeing worse dietary intake and diversity among the Lebanese. When we zoomed into children, and I'm just in the interest of time, I'm not going to show the very detailed tables, but there is overall inadequate dietary intake among Lebanese and refugee children. These are the, sorry for the interruption of the vitamins and minerals, but these are the ones that we noticed have the most inadequate rates. If we were to compare, yes, the refugees had worse intakes of the following vitamins and minerals as well. And I'm only presenting those that we're talking about 100% inadequate and 90. There are some that are 40%. Almost none of the nutrients that I explored had adequacy level that we can talk about comfortably. We looked also at the nutritional status, and we noticed that the Lebanese had higher rates of overweight and obesity in that age group. This result is not surprising given the literature, that there is mixed evidence about the relationship between food insecurity and obesity among children. But in general, the more food insecure a household is, the less likely they are to be consuming foods that are of high quality, the more likely they are consuming foods that are, as we call them in slogan or the slang, junk food, which is high in calorie. It would give you the quick, sodas and whatnot that would give you the calories but wouldn't give you the quality. So that is usually a risk factor for overweight and obesity. We also saw that among the Lebanese, significant differences. Those with low refugee population, like the pre-crisis, they had higher rate of overweight, which could be that there's also lower dietary intake adequacy also among those that are hosting high refugee population. So these are the major conclusions. I'm going to skip this because I've talked about it, but I'll talk about the recommendations. Findings from this study do highlight several matters. This is not an intervention, but this is, if you want, a stepping stage or platform for thinking of what we can do. We need more, of course, adequate social and welfare programs and food assistance. Most among those that are most vulnerable. We need to think about those that are receiving the heavy burden of the large refugee numbers, and this is not going anywhere. Unfortunately, with the closing of the borders of several European and international nations like the US, this number can only increase in Lebanon, as we were hearing from the speakers. We need tailoring public health interventions to alleviate this double burden of overweight and micronutrient deficiencies. We're calling this the hidden hunger. You don't see a child hungry or an adolescent or a mother hungry, but they are hungry from inside. In terms of policy recommendations, this is very specific to Akkar. Akkar is very rural, yet we do not have a good use and maximization of the arable land. There's a lack of technologies and skills among the farmers to basically maximize the use of the land. And if you were to compare Bekaa to Akkar, it's definitely Akkar is much less developed than Bekaa. So we need to think of that. We need to think of sustainable solutions. I know some of my colleagues are going to be talking about community gardens and other, hopefully, more sustainable solutions post this session. Thank you, and sorry for running late.
Thank you very much. Next, we have Syrian Abdurrahim, who is speaking on a subject, as I mentioned before, that is growing in its scale and is one of the worst coping mechanisms that any family resorts to when extreme deprivation is facing them, and that is the issue of child marriage. Syrian is an associate professor and chair in the Department of Health Promotion and Community Health in the Faculty of Health Sciences here at AUB, and studied also at Berkeley and the University of Michigan in Ann Arbor. So thank you, Syrian, and the floor is yours.
Thank you. Thank you very much. I'm very happy to be here, and I'm very happy to be presenting on behalf of the Early Marriage Research Team in the Faculty of Health Sciences. Some of them are in the audience, Dr. Young, Dr. Rima Murtada, and Dr. Hudazre. We have been working on studying and understanding early marriage for a little over a year now. And what I'm going to do in my presentation is I'm going to describe to you the process and some of the things that we have been doing, present just a little bit of results from a formative research study that we carried out during the summer of 2016, and then just walk you through some of our plans in the near future, starting an intervention to mitigate the determinants of early marriage among Syrian adolescent refugee girls in the Beqa. And we're working through the framework of community-based participatory research. I'll say a couple of things about it. The subject of early marriage or child marriage, as many NGOs and the media call it, has actually received a lot of attention with respect, particularly with respect to Syrian refugees in the region. Although age at marriage has been increasing steadily in the whole Arab region, there remains pockets in some Arab countries or some pockets in the region where early marriage is actually remains high and is actually on the rise, or there are arguments that it is on the rise as a social phenomenon in different places. And with respect to Syrian refugees in Lebanon and in Jordan and other parts in the region, there's been a lot of media attention to early marriage. There has been some NGOs who wrote reports on early marriage. And it is presented as a problem with respect to what Syrian refugees in general are going through. Early marriage has traditional drivers. There's some research on early marriage or some research on early cohabitation or teen pregnancy in some countries and some contexts. And the drivers of early marriage in general fall into, I mean, this is based on the literature and the writings on this social phenomenon. The first thing that people address are what's called cultural factors, that basically where there are cultural beliefs or values that accept early marriage, and it's actually it's other determinants of girls not going to school. But the two main factors and drivers of early marriage in general are poverty, poverty and family vulnerability, where early marriage becomes an economic coping mechanism for some families who have young adolescent girls who are neither going to school nor working and are staying at home, and lack of access to education. Lack of access to education, either not being able to enroll in school or not wanting to go to school because of other factors. There's very little information about what are other drivers that even increase early marriage in contexts of conflict and displacement. And what we have been, with the little literature available and with some of the fieldwork that was done throughout the past year, some of the drivers of early marriage, particularly in displacement contexts, have to do with changes in family structure, where sometimes the father is not at home and the mother feels responsible for the honor of the girl and finds that early marriage is the only way for her to protect her daughter. Weakening of community ties, where in displacement people end up living with neighbors they didn't know before, and they feel that they don't know the neighbors and cannot trust them. This all feeds into a sense of insecurity and fear of having the girls being in public spaces or lingering and not being in school or not being married. And this contributes a lot to the immobility of girls. So girls can no longer girls are kept at home, and boredom and not having anything to do actually makes the girls themselves think that early marriage is a way out of the conditions that they live in. And in some cases, there's been some reports on school access and school attendance by Syrian refugees. One of the reasons why in some cases children or girls particularly stop going to school is the fact that they are exposed to stigma in schools, in classes, by the teachers, by peers. The framework that I want to describe very quickly that we're using to study early marriage is community-based participatory research. It's a methodology, it's a way of thinking, a framework and a methodology that is used frequently in disciplines like public health and education and social work and perhaps other disciplines as well. And in this methodology, researchers actually engage actively with community members who are affected by a social problem or phenomenon, and they engage with them throughout the whole process, throughout the whole research process, starting from defining the problem to identifying solutions, and very importantly, taking actions, so identifying the solutions and taking actions in participation with community members, and then at the end evaluating the outcome of an action project or of an intervention. Before we started the thinking about using community-based participatory research in carrying out an intervention to mitigate, to focus mainly on the drivers of early marriage. But before we did this, we actually the team reviewed a lot of documents on early marriage. We found very little that discusses early marriage in conflict settings, a couple of reports, and these reports actually present an argument that early marriage is increasing. However, we are not sure that the methodology or the data supports the fact that early marriage is increasing. This is not to say that we're diminishing the importance of early marriage as something that inhibits the opportunities of young girls. But we're not sure that the methodologies that were used support an argument that early marriage has been increasing, particularly given the short period of time and the limited data available. So what we started out with is we decided that we want to do some formative research to get accurate estimates on the prevalence of early marriage and its key determinants, which is just as important. It's not only the prevalence of early marriage, but also what are the factors, the social determinants and other determinants. And we decided to focus on a specific area because in general, frankly, because of limited resources, we thought we would focus our prevalence study on 3 towns in Biqa. And the formative research was carried out mainly by the early marriage research team members. We received also technical support from Dr. Marwan Khawaja at ASQA in terms of sampling and data-related issues. We had Ms. Farah Sbeiti, an MPH student who worked with us on the study as well. And it's very important to note that UNFPA actually funded the prevalence study, and we carried out the study in collaboration with a local NGO that's started by Syrian refugees themselves, SAWA for Development and Aid. Very quickly, it's a typical survey study, which we carried out during the summer of 2016 in 3 towns, Marj, Bir Elias, and Elias, 3 towns that are geographically close to each other. And Syrian refugees in the Biqa live either inside tented settlements or outside tented settlements in Lebanese communities. So we had to actually use 2 types of sampling methodologies, one for the families who live inside the settlements, and one that was less probability-based for outside the settlements. And our inclusion criteria is, we were looking for Syrian families who came to Lebanon since 2011. And we use the terminology of since the crisis of 2011, so in order not to use any language of either the revolution or the civil war. Of course, we were looking for families that had at least one girl or woman between the age of 9 to 24 years old. We were hoping to actually include 2,000 families, but because of some challenges that we encountered inside settlements, for example, we found a lot of tents that were empty after we had gone through the defining the sampling frame. So we ended up with 1,513 families in our study, and from these families, we have data on 2,400 girls/women. The questions or the data that we have are on family structure and the socioeconomic status of the family or the husband in the case of if the girl or woman is married. School attendance, whether the girl attends school and what kind of school, and actually whether the girl attended school in 2015, 2016. And then, and of course, questions on early marriage, age of marriage. And for those who are married, we ask questions about reproductive health. So our sample, I just wanted to clarify that we are not, when we use the term Syrian refugees, in fact, in Biqa, the majority of our sample came from just a few governorates in Syria. Our sample is not representative of all Syrian refugees, of course. The majority came from Aleppo and Daraa, and also from Damascus and rural Damascus, Homs and Raqqa. So around 87% of our sample comes from, originated from these governorates in Syria. We had 0 from Latakia and 0 from Tartus, I think, which makes sense. So school enrollment is extremely important for early marriage. In fact, our data show that the girl is either married or in school. I mean, there were, of course, there were girls who were neither married nor attending school. But and this corroborates also data on Lebanese and Palestinians. Once the girl gets married, she's almost 99% sure that she will not be able to attend school or does not attend school in the following year. And what we found was that actually a little bit more than 50% of all the girls in our study, and I'm focusing here on 9 to 17, of course. This is not all the girls, women. From the girls who are 9 to 17 years old, half of them were not enrolled in school the year before we did the survey. And as you see here, 2 minutes. And as you see here, it's at age 13, 12 and 13 where school attendance drops. School attendance is determined by whether the girl lives inside or outside the camp, tented settlements, and which area, which city or village they live in the Biqa. But most importantly, school attendance is very much determined by the girl's parents' education. So this is an intergenerational vulnerability. When the parents have higher education, the chances that the girl will not attend school are much lower. Also, when the father doesn't work, the chances that the girl doesn't attend school is higher, actually. I just want to show, this is the data of marriage. Here we're showing when early marriage starts. The red bars are, this is marital status, and the red bars are the girls who are ever married. And you see that at age 15, there are 2 girls at age 14 who are married, but it's at age 15 where this early marriage, where marriage increases. And by age 17, we have 37% of the girls are married in our sample. So these are very quick findings from our formative research. In the next minute, I'm going to go very quickly over our plans for the intervention. Currently, we're going through a phase where we are first deciding on the site of the intervention based on both scientific and practical criteria. At the same time, we're also engaged or starting to engage in building relationship with the municipality, the school system, the community, and the NGOs themselves in order to start a coalition and start the process of the community-based participatory research. I just want to show just some of the things that we are using to decide should we do the study, the intervention in Marj or Bar Elias or Ab Elias. This is data from Bar Elias, and the blue bars are school attendance, and the red bars are early marriage. So one of the things that we are considering is that if we do the intervention in Bar Elias, and if we do it, we include girls from age 11 to 14. What we are doing, we are including girls who are at risk at some point of no longer being in school between age 13 and 14, and who may be 2 years away from the risk of getting married. So we're looking at these types of graphs to actually decide which site provides, data that where there's scientific evidence that intervening on early marriage at a certain age would have a higher impact, hopefully have a higher impact through the intervention. And this is my last slide. The process of the community-based participatory intervention will go through phases. So one of the first things that we will start with is actually introduce the community. The community meaning Syrian refugees themselves, but also stakeholders from the Lebanese community, such as municipality and schools. What we want to do is introduce them to some evidence related to the drivers or the determinants of early marriage. Through community consultation and meetings, what we will do, and engaging the community, what we will do is add to those traditional drivers some of the other things that the community thinks contributes to early marriage, and then start to design intervention points and plans and work with the community to take action in order to reduce, to mitigate these social factors and hopefully have an impact on early marriage. I lied, there's one more slide, just very quickly. So there are challenges, of course, to conducting community-based participatory research. There are general overall challenges that everybody faces. The issue of this research is time intensive because you have to work with the community. You can't just come with your own plan and drop it on them. Sometimes communities experience fatigue, because especially communities who are disadvantaged. They want things to change quickly, and they start to think that these community meetings are a waste of time. Evaluation challenges as well. Sometimes an intervention does not have an impact on the outcome, but it might have an impact on community level measures, and we need to keep that in mind. With respect to challenges specific to the project that we are thinking about, we have thought about questions related to what do we mean when we talk about a community, when we have refugees who are mobile, who might not be here next month after we start because they want to go somewhere better. So mobility and the sense of community are things that we will be challenged with. And the final thing is we're not going to implement this intervention in vacuum. We will definitely be affected by Lebanese policies and changes in the Lebanese context. So thank you very much.
Okay. Thank you very much. In the interest of time, our next speaker, Faisal Al-Kak, has offered that I skip his bio. I should, however, mention that he's a senior lecturer at the Faculty of Health Sciences here at AUB. Also, he's a famous champion for refugee rights, which is a great thing. And I would be remiss if I did not mention also that he is an all-round good guy. And that was an unofficial title that we agreed earlier. So Faisal, the floor
Thank
is
you,
yours.
Luciano.
Yeah.
Good morning. Again, I have to thank Nasir and Diba for inviting me to speak on the challenges facing women's health in Syrian refugees. I'm going to start with the Vasir highlights, as Luciano mentioned. And they identified, as you can see, 6 areas. One is on residency, pointing out that 1 in 5 households reported all members held legal residency permits. And this has a very serious reflection on women's health registration, delivery, and also legalizing the newborn. And that's declining from 28% in 2015 versus 58% in 2014. The other vulnerability also that we have to keep in mind is education. 48% found to be out of school. Mr. Lazzarini mentioned this morning 200,000 children, the highest in Bekaa, around 71%. Pervasive poverty, food insecurity, children and new disabilities, and the last area is persistent vulnerability in the sense women and children in relation to health and basic needs. 16% never had an access to healthcare, and that will be my focus. At times of conflicts, women and girls, they have challenges related to access to essential services and distribution of healthcare in terms of the type of services you are providing, weakened emergency health system affecting women, whether by fatigue of the health system or whether by excluding women from seeking care. And the last challenge is the dual role of women, as now increasing number of them are leading their families at the same time being marginalized from the healthcare system. In specific, the vulnerabilities, they fall into these categories: reproductive health, maternal health, violence, mental health, and issues related to fertility. We know very well that war and gender cause inequalities in health, especially in relation to fertility and maternal mortality. And you can see in this table, comparing countries with the conflict in the past 5 years with countries to no conflict, there are a remarkable significant increase in relation to total fertility rates, maternal mortality rates, contraceptive prevalence rates, and skilled attendance at birth. They all are seriously affected and definitely impacting women's health and newborn health. In our case, there is an obvious change in the crude birth rate at 40% in some of the papers coming from the Zaatari camp in Jordan, 24% in Lebanon, to 15% among the Lebanese in Lebanon. The other alarming also issue is the contraceptive prevalence rate. It reflects the use of birth control methods among married couples. It was 60% in Syria before the war, and now it's down at 34%, which is again alarming. And also there is a uptrend in the maternal mortality rates, expected uptrends. This is in relation to the issue of fertility. This is published in Conflict and Health 2015, showing the desire or the attitude of women of various ages intending to get pregnant. And you can see those who said yes among adolescent and young women desiring to get pregnant. The other one is related to the maternal mortality, and you can see the trend of increase according to this document coming from the WHO and the EMRO region. The third vulnerability comes from the conflict itself affecting mental health. Between 20 to 38% of those women living under conflict are suffering from mental illness issues, with 20% of them end up with a long behavioral and health problems. The issue of violence, it was mentioned by Southern teenage marriages or adolescent marriages or child bride is a form of violence. The issue of rape, we're working on a paper to be released hopefully in January or not January, we have the first draft now, but in March or April on sexual violence, sex work, and also domestic and structural violence in relation to seeking health care are all forms of violence, again, that the Syrian women face. If you want to talk about potential interventions and the categories of these interventions, you're going to think of research, like the theme of today and my colleagues were talking about. Also intervention around access, looking at funds, at policies, at social media that Dr. Khattas also I think will be talking about, and also engaging women through local workers. This is one of the almost completed work on fertility patterns, and I think it's impressed, Dr. Murtada, I think it's impressed. And the highlights on the study of fertility patterns among Syrian refugees, again in the Bekaa region through qualitative work. It shows 4 main areas that women, they tend to have higher fertility rates because they don't want to use contraceptives because they worry about their husbands getting another wife if they don't get them enough children. The other reason about dignity, okay, Syrian women avoid seeking care due to being mistreated by Lebanese doctors. Unfortunately, I know this for a fact as a healthcare provider. Compensation, some want to have more children to compensate for the children lost, and that's expected. And convenience, as many Syrian refugees were not aware that the conflict is going to last for 5, 6, or 7, or 8 years, so they thought we're in Lebanon, it is the place with good medical care, let's have our children here before we go back to Syria. This is in relation to fertility. On research on maternal health, we're working on a proposal with the colleagues at the Faculty of Medicine on assessing pregnancy and neonatal outcomes of Syrian refugees in comparison with the Lebanese population in tertiary care centers in Lebanon, specifically in the Beqa region and in the north, which is a hospital-based collection of data. The primary outcome will be prematurity. This is a very serious issue in general among pregnant women, more so among the Syrian women who are pregnant. One, because of the impact on the maternal health. Second, because of the impact on the newborn in view of the limited places in the intensive care nurseries that we have hard time finding them for the Lebanese women. What about also for the refugee? That's a very serious problem. Also, we're looking at secondary outcomes to the maternal health and newborn health, like cesareans, like antenatal care, and other stuff. The other two, again, that relates to intervention in terms of research and data is determinants of contraceptive interruption during displacement among Syrian women living in Lebanon. This is expected to be supported by the Society of Family Planning, IPAS, in collaboration with AUB, in specific with the Faculty of Health Sciences. And the other one is with the Royal College of Obstetricians and Gynecologists, the global initiative within the Royal College on postpartum contraception, again, because of the growing fear of lack of birth spacing and the growing fear of the low and continued reduction in the number of use of family planning methods. In relation to access, the intervention in relation to access, and we've been able in Lebanon, despite all the squeeze and despite all the fatigue of the health system, to not to arrest, but not to let the rate of death among pregnant Syrian women to be like high or out of proportion or anything. Okay, as you can see in this table, over the past 2010 to 2015, okay, we're almost kept very comparable numbers of maternal death, and Lebanon, by the way, is the only country in the Arab region to achieve the MDG 5, that is reducing maternal mortality by 75% since 1990. And the influx of the Syrian refugees, I'm talking about 39,000 deliveries per year. بلبنان بيولدوا 70 to 72,000 per year, Lebanese. We have 39. And we don't have any abrupt increase or unusual increase, okay, in the number of the maternal death among Syrian refugees. That's because of the, I think, of course, the active role of the ministry. It's because also of the resilience of the health system, and also because our experience with wars and conflicts and displacement, we're able to take care of this. This is, for example, the number of Syrian women who died 2012, 1, 4, 3, and 4. Lebanese is like 19, 13, 11, 16. These are cases of death, okay? Palestinians, 1. We have 1 also from Bangladesh. So we're almost in phase with our excellent record, hopefully to be reduced even more. In the last few slides, so I'm gonna comment on the upcoming challenges, and these should fall within the Vasir report that I've mentioned earlier. In terms of data, there is more need for understanding the communities. That is, there is a more need for needs assessment, and also for understanding the efficacy or improving the performance of the existing health systems in terms of identifying high-risk cases, referring them, places of referral, so on and so forth. And innovative interventions that, in my opinion, as a public health practitioner and healthcare provider, should fall under modular programs that will emphasize maternal health, definitely, and child health, but at the same time should emphasize, again, reproductive, sexual health, including violence against women. Women health as a social media, and you will hear excellent, I think, example and research from Dr. Ghattas, and local networks. And the ministry now is pushing to have local, like midwife or social worker, that will be connecting with the group of women and to link them to healthcare through regular meetings, through advocacy, and of course using the social media. It's important to look at this because, as also mentioned in the introductory comments, and also by Luciano, on the vulnerability map, the resulting composite map of 1,561 localities, most vulnerable, fifth, amounts to 2 to 5 localities. So you might be thinking of addressing differently different localities, tailoring different interventions to different areas in terms of levels of health and wellness, in terms of the needs, and so on and so forth. And that's important to look at this map. And a productive starting point, for example, is to develop a package of basic health services with proper funding in view of the shrinking funds. Now, everybody knows they're paying, UNHCR and others paying 75%, and others are paying between 15 and 25%. But this is even shrinking in support and shrinking in the content of that package. Okay? So redesigning a package of basic health services based on local information collection and based so far on the data accumulated over the past 5 years. Make sure to have equity and non-discrimination, and that's essential, within the Syrians themselves and also between the Syrians and the Lebanese, and make sure to engage women, and also, this is my bias, to always concentrate on comprehensive reproductive health services. Again, keep in mind multilateral and bilateral funding programs that links strongly the move between humanitarian and development links. This is the example of that modular program with its outputs and outcomes. I want to highlight here the guaranteed package of health services and the stewardship of the government. Okay, that will hopefully allow for equitable allocation of services based on need, and the other one by enhancing solidarity, social solidarity and cohesion through engaging local community in different ways. I'm gonna jump this to reach to the conclusion. The conclusion, I want here just to emphasize universal coverage of the health services. Make sure funds are sustained, keep on building skills, and that's what we're doing with the Ministry of Public Health, building skills of healthcare providers, engaging women, and of course, to generate more data. Thank you very much.
Okay, as always, we're running out of time. The last but certainly not least panelist today is Anis Al-Khroub. He's the chairperson of the Department of Education here at AUB, and an associate professor of education, psychology and special education. And as I mentioned in the introduction, is going to speak to a subject that is often underrated and under-prioritized, but fundamentally important to the well-being of children, and that's psychosocial issues. Anis, the floor is yours.
Thank you very much. I'm going to use my computer because I've got a video here with a large size. Right. Thank you very much for inviting me to this panel. My name is Anis Lahroub. I'm a psychologist. I'm in education department. In this project, I worked with a group of Syrian teachers by providing psychosocial activities and intervention plans for the students, through the teachers themselves, by providing some training workshops for them. Training workshops that focused on the main issues that will be important in dealing with the students, Syrian students, like dealing with the many emotional, social, and psychological issues. In this presentation, I'll be showing in some pictures about the conditions there, actually in Al-Biqa', and just to be acquainted about the things that we were dealing with, especially with those kids. These are some pictures about, the area where I'm going all the time, and I'm training the teachers. And this is project, by the way, it's a Center for Civic Engagement project. They're working in collaboration with Kayani organization. So I'm working on this in this particular part. So this is the kind of things that we can see there, the kind of the camps in Al-Biqa'. So you can see the poor conditions for the people living there, where they can just find any piece of land and they can have their tents there. So some pictures for some singers even. Kids, they're going to school. And this is one of the schools. I'm going all the time to do some training there for the teachers. So this is a kind of the toilets they've got. The ceilings, where they can have a lot of leaking actually from it, especially in the winter. And the water tank, where they can have, the water. And this is like the school again. One of the parents is dropping his daughter using this motorcycle as a transportation mean. Well, and this is one of the schools in Saad Nail. So in different places, Saad Nail, in Anjar, in many other areas. Kids, during winter, this is a space, it's raining, so there is no space actually for them here. This is the only umbrella for them to hide. And this is the kind of activities I worked with the kids, with the teachers themselves. When I trained the teachers, of course, they had to be trained by using some certain manuals. 3 manuals I already drafted, and the 4th one actually just recently in November, dealing with different issues, like dealing with loss and grief, dealing with sexual abuse and harassment, memory projects about their, home, child development and child basic rights, dealing with aggressive behavior, overcoming stigma and discrimination against refugees. It could be discrimination by gender as well, by nationality, by color, by skin. So I worked with them by using different activities, different stories, different kinds of training, workshops, worksheets as well, books, many things. So today I'm not going to go in detail to talk about each of these intervention plans or intervention activities. Just one of the things that I'm going to mention, which is one of the most difficult, intervention activities I went through, is the dealing with loss and grief with the students. Of course, it wasn't easy for me even to deal with it, especially with the teachers, because they lost some dear people, siblings or parents or some relatives in the war. So they have to be trained in order to train the kids in how to deal with that issue. So I'm going to show you something about that. This is a class where after I trained the teachers, they had also to go through the same thing by sometimes telling a story about similar issue, like maybe a child, let's say, who lost one of his parents in the war, and then having some discussion about it in the class. This is a class for grade 6, where the kids were being engaged in different video. I'm not going to show it here. So the kids, they were emotionally engaged. Many of them, they start to talk about their personal issues, about their maybe losing some parents or some dear friends or relatives. Many, they start to cry. So it was totally emotional. So that was the first part of it. Though I gave some, training activities for the teachers, but I realized that many of the kids and the teachers, they wanted to use their own sometime, to use their own ideas of how to release sometimes the negative emotions, and by using different techniques. So this is the one first. So the teacher is telling the story, and then many kids, they start to talk about their own perspectives, about their personal things. Then they decided to do something themselves. By the way, that wasn't something that I imposed myself. Well, they said, let's have actually the painful memories to write them actually and put them in balloons, blow balloons, and then try actually to pop them, or maybe to throw them. That was one of the things that it came with them. So we'll see here, some of the kids, they left the class, okay, and they decided to just keep the good memories to themselves and to throw the bad memories in the air, or not, just to try to make them vanish from their memories. So this is one of the things that they've done. This is a class. Okay, I'm going to show the video here. Is there a volume? Can you hear? You cannot, right? In the beginning, they wanted just to throw them without popping them. Then they found that it's maybe better to pop them actually without even just, they want all of these painful memories and experiences just to vanish. And just look at the determination. It took them a while. This is out of the siege. This is out of the school. So you can notice now, some of them, they'll jump, or just to pop them. Until the last balloon. Look at their faces, how happy they are now. Completely different people, different kids. Yeah, I want to show it until the end because they will be determined until popping the last balloon. And this is really important.
المهم راح بعد عنا إذا ما طاق راح بطل مبين إيه ما ضل شي
Look at that kid. So happy.
ما قدر إلا طقه ما فيك برافو عليك
Right. So this is just one of the activities I use. Okay. And as I said, though I used many other activities with them, but this is something that they thought about themselves. It came from the kids. They thought about their good and bad memories. They want to keep the good ones. They gave me the good memories actually in some papers, the green ones there. They've written about what they want to remember in their life, and the things they don't remember is the ones just they popped in the bad ones. Thank you very much.
Thank you, Anis. Our 25 minutes has somehow ended up as being 12 minutes for Q&A and discussion. Perhaps we can maybe fit in 2 rounds of questions. I would suggest whoever wants to ask, put your hand up, and we'll take 3 at a time. So 3 and then another 3 if we make it. So 1, 2, and there was one at the back, 3. Please introduce yourself and direct your question to a specific panelist.
My name is Amal Karaki. I'm the head of the Social and Economic Planning Unit at the Council for Development and Reconstruction. And my question goes to Dr. Juma. Your research was done in Akkar, which is a rural context. Do you have any intention to carry out a similar research in an urban context? Because the majority of refugees these days are there is, this concept now of urbanization that's being witnessed. So maybe you might think of carrying out a similar one in an urban context. Also, did you take into consideration, let's say, seasonal variation in food provision? And regarding the control group, the Lebanese, I would like to suggest there is a national poverty targeting program which is implemented by the Ministry of Social Affairs and the Council of Ministers. And we have a sample of Lebanese households who are characterized as poor, and the database is available, and a statistical framework is available. So maybe you would like to consider this in the future.
Maybe we'll do the other 2 and then we'll come back to you. Okay, thank you. The second was, yes, go ahead.
Yes. Hi, my name is Mariana. I'm from Ahmadiyst. And I have 2 questions, actually. One for Dr. Abdurrahim Sausan. Okay. I'm just going to ask you about, did you find any challenges from the families of these girls when you wanted to actually tackle this problem? I mean, did they prevent you from having face-to-face interviews with these girls, or did they were very open and welcome to this idea, to talk about this as a problem? That's one. And my second question to Dr. El Hroub, if it's possible to ask you, were you able to actually ask these kids to share these experiences at home with their parents, or there's no way they can share these moments with their parents, or they're just doing that at school? Thank you.
Thank you very much. And the final one for this round, yes, in the middle at the back.
Hello, my name is Yasser. My question just is a sort of a social commentary for what Dr. Lamis has talked about the food security in Akkar. I'm from the town of Bibnin, which was mentioned in his study, and I just wanted to say that in the abstract that Dr. Jum'a talked about, it says that the proximity of the governorate to the Syrian border was one of the factors that there's a lot of people there. But as a testimony from someone that actually goes up there, that of course that is true. But there is another factor that people in that region, they do feel disenfranchised by their own government in a way. So they feel more socially integrated with the Syrian hinterland, as we say. And another factor that I think really pulls into the fact that people from Syria go to Akkar is that people from Akkar actually accept them as equals. So people like Syrians there, they get married to people from Akkar, they work there. They don't feel the discrimination that they've felt otherwise in other places. And I'm very thankful for Dr. Jum'a, even if the people from Akkar were considered as a control group in your research, that it took a crisis of this proportion to actually have a study about food security in that place. And the results that she deduced showed that there is a sort of similarity between even the status of the refugees and the people there. Just to add for the proximity factor, in Dr. Abdul Rahim's study, I noticed that people from Aleppo mostly went to Buqa, which is not really the most geographically best location to go to, because Aleppo is much closer to Akkar. But they chose Buqa rather than Akkar. So that shows there are a lot more factors that I know we can't cover over here, but it should be taken into consideration when we do that. And thank you for that.
Thank you. Thanks for the comment. Perhaps then I will hand the floor to Lamis for the first question, which was around urbanization.
Thank you. I really appreciate the questions. They basically, they're very to the point, if I may. Sorry if I missed the name, but I'm very happy that you asked whether we're interested in looking at it from an urban setting perspective. Yes, there's a lot of migration of refugees and the Lebanese that are not finding enough employment opportunities or, in general, sustainable solutions for them in their home settings, so they are moving to the urban setting. There is a plan for a project similar, although it's not necessarily the same age group and exactly the same objectives. Looking at a comparison between the refugee and the Lebanese host community in the area of Beirut and Mount Lebanon. And it's a partnership that's currently in the making with the Food Security Center at the University of Hohenheim. So next week, actually, we have a speaker coming from there, and we're going to be talking more about that partnership. We're looking more, their interest is more in maternal and infant health, under 5 children, basically, particularly that first year. And they have several questions that they're interested in looking at it, and we are interested in partnering with them to talk about that, but from an urban perspective, if I may. Your other question or suggestion, I think, was about the national poverty strategy, and in terms of the aid that's being provided by particularly highly vulnerable Lebanese households in that region and other districts across the country. I am aware of it. Thank you for mentioning that the database. I'm always happy to know there's open databases that we can actually touch upon. So maybe I can talk to you after the session to get more information, because I think it's very helpful if we were to actually even target those specific households that are receiving the aid and see, further explore, if you may, the dietary diversity, the food security status. Again, this is a very perceptive approach. We are asking them what they perceive themselves, whether they are food secure or not, which in by itself could be a limitation sometimes when you have reporting biases. But we are going with this and with other basically data collection methods in order to find the validity of that information. And did I miss any other third question from your end? Okay, thank you. And for the gentleman in the back, yes, I'm glad that first that I covered your town. It was coincidental. I also want to say that the Lebanese host community deserves much more than just one study in Akkad. And I wanted to say first that they weren't necessarily only a control group. Actually, there were 2 Lebanese groups. One of them is the comparison. It's almost like the pre-crisis. And the other one was the post-crisis, which is receiving the high number of refugees. So but I do want to say that there's actually a national study that was conducted by myself and a research team at AUB looking at the household food security status of Lebanese in general. And the results aren't out yet, but we're hopeful to release them. And yes, there were a lot of government and regional disparities in terms of food security. So because we identified that there's a gap and that we do not need to only focus on one side of the element. I know that the UN agencies and international NGOs and the government are really working hard to include both the refugees and the host community, but I think the efforts are still, there's a lot of room, and I'm hoping that the UNICEF can also comment on that, probably. Did I miss anything else?
Great. Then, Susan, that was the question around resistance from families in collecting data.
Okay, thank you. I think it's an extremely important question, the one about whether the community itself or the parents see early marriage as a problem. We're going in as researchers and with an agenda that early marriage is a problem. And just to clarify that in the prevalence study, we actually collected the data from adults, not from the girls themselves. So either the mother, in most cases it was the mother, or if the girl or if the woman is 18 years or older, then we collected data from her. But we collected data on younger girls from their mothers. The issue of whether the community considers early marriage a problem or not, I think from our interactions with the community, from our field visits, the community sees other problems that lead to early marriage. And they see early marriage as the outcome of vulnerability, literally, and vulnerability very much related to gender, that there is a need to have a man protecting the woman. So, and in the intervention, the community-based participatory intervention, one of the things that we need to work on is to actually address the problems that the community sees that relate to early marriage. We're definitely not going into to say early marriage is bad and we want to work with you to end it right now. We need to work on all the other issues, all the other determinants that make early marriage a viable coping mechanism, a viable economic solution for the other problems or the conditions that the family is confronting.
Very good. Thank you. And the last question for the round was for Anbis around the interaction with the parents.
In this project, unfortunately, the parents, they are not involved directly as partners, but I didn't tell the students not to tell the parents about the activities. So actually, this activity was very effective, and they were talking about it to their friends, the teachers, other teachers, and I would assume also the parents. The parents, they are involved indirectly through the counselor who's been assigned just recently. And the counselor is working with me at the individual level. If there are some problems, actually with some individual kids, she's contacting me, and I'm working with her to work on some specific issues. But with the certain activities that we're showing here, so I didn't say anything to the kids not to tell the parents about. Of course, they can have the freedom to talk about it. Yeah.
So we are exactly at 12 with apologies, but you know where the panelists live now, so you can accost them after this session. We, just out of respect for the following session, which starts right now without a break, we do need to wrap up. Maybe just a few thoughts from my side. I mean, my three takeaways, I think, in all of these discussions, without going into the sector specifics. One is the incredible opportunity for connectivity between all of these issues that we've talked about. So often we fall into the silo trap, but every single one of these themes has a clear and present connection to the other, and working on all of them in parallel and simultaneously, I think is the only way to go. The whole holy grail of integration in responding to these affected children remains the aspirational goal. The second thing that came through in a number of presentations was the preeminence and the criticality of working through the public sector, the system that is already here, as the most sustainable and cost-efficient vehicle to deliver these services to the most affected children and families. And the third, which I'm always reminded of in events like this, is how much is being done by so many different individuals and organizations, and how we're all collectively so bad at sharing these experiences and this knowledge. So thank you to AUB for bringing us together. We keep saying at these events that we will have to make sure that we continue the conversations and turn them into action. There is certainly lots of action, but I think I walk away here with a strong impression that we must work more closely together, and academia has an absolutely vital role in informing the response of the operational institutions and agencies. So thank you to the 4 panelists. It was a pleasure. Thanks for being with us this morning. I will hand the floor to, I don't know, Lily or Nasser to introduce the next session. Thank you.